vision for EntheoTech is to destigmatize psychedelics in mainstream view. We want to be able to have ET be seen as a responsible kind of gold standard of treatment that is really paving the way for people to see these as tools and technologies that people can use to deepen their relationships with themselves and really be a true healing power in the modern world. The unique approach we've taken in the psychedelic industry, I believe, is to have a pool of different practitioners and specialists that are all looking at psychedelics from a different angle and from a different training background. Myself, I don't see psychedelics as a panacea. They're not a one pill fix. Psychedelics are a way that people can have a psychological opening or transformational experience, and it's the other support and other modalities that we can build around that experience that is really going to help someone shift and change the relationship they have with themselves and how they interact with the world too. So for us, it really comes down to the therapy model that we have that we're applying to our clinics, and it's really that end-to-end care of the patient. So we're really walking them through the whole journey and ensuring that they have expert care throughout that, and it's not just a doctor or a pharmacist or a breathwork practitioner. It's really looking at that collaborative care model and how we're supporting that person holistically in an integrative way to really help them change their life.
I am a co-founder of the busiest pain clinic in Canada, the Bill Nellum's Pain and Research Center. And I've been interested in adding to the treatments that we offer there for patients, because we are doing interventional pain treatments. They are very effective, but I think we can do better. And in this regard, I've been looking at the benefits of ketamine specifically in helping patients with acute suicidal ideation. And I've been impressed with the results that I've seen with my own eyes in the ER. And I've been reading the studies over the last 5 years on psilocybin, specifically with regards to alcohol use disorder, treatment-resistant depression, end-of-life anxiety and distress. And I've been very, very impressed with the result I've seen. EntheoTech has a really very interesting sort of a place in the psychedelic industry at present, because we are a group of physicians and RNs and psychotherapists and psychiatrists that are interested in looking specifically at chronic pain and comorbid, depression and anxiety. We've got a very, very diverse team of clinicians, specifically looking at research in this field. And in fact, our first study that we're going to launch is going to look at reducing opioid use in patients with chronic pain by using psilocybin.
The Odyssey Method captures this idea that the wellness process is not something that just gets done. It's a journey. It begins with understanding more about an altered state of consciousness, where you find your true self, and that requires support, preparation, and education. And you slowly shift your mind to looking at your life and the world in a different way. And when you actually have a dosing session or a psychedelic experience, that really opens up. Now you see things differently. You've been shown something. You've been provided an opportunity to access a higher level of consciousness and to access your own inner healer. So we're working together with a person. It's not something we're giving them. It's something we're supporting them to do. And that doesn't finish at the end of that session. That's something that involves integration and support and community, so that you can capture that change in your thinking. It lights up your brain in areas of your life that have been neglected, that you probably remember when you were a child, the wonder and joy that you found in the everyday. That gets turned on again. And that's where we have a real opportunity. And the Odyssey Method talks about that from beginning to end.
I see enormous potential within the world of psychedelics to help treat different conditions that we've been completely ineffective in treating with pharmaceutical interventions and talk therapy in the past. I really feel like psychedelics are offering us an opportunity to really move through and move past some of these really debilitating conditions that hold people back in their lives. And I think psychedelics have huge potential to provide a different sort of therapy in which it provides a catalyst for transformation And then along with the other modalities that we provide through EntheoTech, the integrative tools, the preparatory tools, really allows that person to see real, long-lasting changes in their lives.
Ketamine therapy is most effective when combined with psychotherapeutic treatments such as cognitive behavioral therapy and other integrative therapies. Ketamine works extremely quickly, often within hours, to ease depressive symptoms. What sets EntheoMed apart from the rest of the clinics in North America is that we are bringing together experts in both fields. Most clinics in North America are run by either anesthesiologists who are experts in ketamine administration or psychiatrists who are experts in depression. We have brought those experts together under one roof. Our approach at EntheoMed is to have medical expertise provided by the anesthesiologist familiar with the use of ketamine, as well as psychiatric expertise provided by our team of psychotherapists and psychiatrists. This allows us to provide our patients with holistic, comprehensive, and integrative treatment care plans that will help them achieve success in their journey with ketamine.